Coleman, who works as an occupational therapist and has been practicing for 15 years. She told me she had just celebrated her 15th anniversary since getting her license, and she's worked in a few different settings. I know, I believe in orthopedics or sports rehab, correct? I don't know.
Mainly orthopedics, but yeah, I can go back into that background a little bit.
Yeah, so she's worked mainly in orthopedics, and now she works in gerontology at a continued care facility, as she had told us about. And Kelly is going to let us know a little bit about her experience in pursuing OT and what her road has been like and her experience.
All right. Hey, guys. Thanks for having me. I actually, towards the middle of my career, I wanted to go into teaching and with OT, but then I had kids, so now I'm just continue to treat. So this is fun to jump into the educational world because it is so important, and it has a lot of opportunities for you guys to learn early on, which is something very different than what I had going into school 15 plus years ago. So basically I went to University of Florida. I'm a native Floridian. I have never left. I'm pretty boring. But I went to UF, and I actually started in communication, and I didn't know what OT was at all. I was actually a caregiver for my grandmother, and I knew what physical therapy was and therapy in general, but I really had no knowledge of what occupational therapy was. And I was switching into sports medicine because I was an athlete, and I just started reading more and more about OT and the diversity of it all and the opportunities, and I just knew it was just going to grow. And it was specific enough as a degree, but there was so much more you could do with it. So and that was something my mentor in college always taught me is, and I think I talked with Monica about this, find that specific degree where you're going to be able to go out and search for the job, and then you can kind of find your setting you want to be in, instead of going to your general business degrees and then going out and trying to find your job. So it really helped to narrow my focus, because a lot of kids go to college for 4 years and still have no idea what they're going to do. But with getting that, I graduated in undergraduate with a health science degree, but fortunately, Florida has a program where we apply for OT school during our sophomore year in college, and they start us on a pre-OT track. So that was huge because they were getting us involved and getting us on that specific track. And I actually was able to get my master's in a 5-year period. So that was a huge financial help and propelling me out into the world. And the debt of school can be taxing.
Holly, ask a quick question?
Sure.
Because you talked about in 5 years, was that, I know I had noticed that there are not a huge number, but a certain number of like the 3+2 programs, which is kind of, like your bachelor's and your master's into one, and you kind of apply very early on. Was that something that was offered at your school at the time, or did you just happen to, for whatever reason, go through an avenue that allowed you to do that?
Well, we were priority. So when we were accepted into the health science program, then we became priority to apply for the pre-occupational therapy program, which we only took so many as well. And then we came priority when it came to grad school. So it was a kind of like a booster. But again, we all knew if we stayed and went that route, we would be out with a master's in 5 years. And now things are transitioning to doctorate programs. So more more schooling. But again, I think the importance, like we've talked about, Monica, and I'll talk about it a little bit more, is getting out into the field and the observations early on, and you're going to learn so much in that setting.
Right.
So a little bit more about Florida I was going to talk about is it was a research-based school. So going back into what I was saying as far as getting into the field and the observation hours, our professors were really focused on the research of OT, and that's important, and we need that for sure in our profession. But I knew I wanted to be a therapist out in the clinical setting, and so I really had to take that initiative and get out on my own. So depending on what school you choose, there were other schools in Florida. It would have taken a little bit long, but they were definitely more clinically focused than Florida was. So we definitely felt like when we got out to our internships, we really had to put our best foot forward, because we were very research-centered therapists, which is very important. But once you get out there and they throw you into the field, you got to run with it. So you got to have that clinical foot forward. And as an OT, I think it's so important to get that clinical setting, even if you're going to go into research or teaching. We have a lot of friends that eventually have gone into teaching and research, but being in the clinic and seeing it firsthand is so, so important. I can't stress that enough.
Yeah.
Do you want me to go into more?
I just didn't know. I wanted to kind of allow you to, I didn't know if you were more comfortable with us, like maybe interjecting with pertinent questions at different points, or if you wanted to just speak and have a Q&A afterwards. Whatever.
Yeah, whatever you guys, I don't know if you can ask questions on this or raise your hand, or I can do questions at the end. I can just tell you pretty much my history.
I have a question
Sure.
kind of that I thought more about in terms of, I know how you've stressed that the clinical settings are so important, and I think they are too, sort of when it comes to field work, which is, I don't know, based on the people who are here who may or may not know. I know there's a level 1 and level 2 field work, which happen at different periods within your graduate education. I was curious about whether you kind of think one strategy is the way to go. Like I had a lot of low vision observation hours, and I was always kind of interested in working with older people, and it wasn't available because of the virus in terms of my ability to get in. And so that was kind of my like roundabout way of sneaking in, which I was so grateful for, but I also just thought it was so interesting and amazing, and I loved it. So I'm curious, just from your point of view, do you think, if you were to do it over again, would you pick something that you felt like, I'm intrigued by this, or something not random, but hadn't thought about this before, maybe I'd like to know more about it, or like, I think I definitely want to practice in A or B, and you'd go towards that? Just, I guess, what would be your strategy?
Yeah, that's a great question. Yeah, that's very important. And I had a lot of friends do different routes, and some were just honing in on peds. I'm going to do peds. That's all I want to do. I'm just going to do peds. And then I had some friends, just going into geriatrics, or had a specific interest into hands or orthopedics. What I decided to do, and I'm not saying this is the best way, but I wanted to see it all, because this was my opportunity to literally get mentored by somebody for 3 months without having to, be on my own. And eventually you are on your own as a level 2 student, but you still have that oversight. So I knew I wanted to get into the nitty gritty of everything on both sides. So I made sure that I got into a hospital setting, because I knew in the hospital setting, you can go there. I mean, they have outpatient there. They have inpatient rehab. They have the acute setting. They have the neuro floor. They have the psych floor. So I knew I was going to, even though I specifically chose a hospital setting, know that you are going to be able to go and see these other types of care. Whereas if you were just going to, say, a SNF setting, especially now with COVID, everything's going to be even more limited. You might not get to go into those clinical settings as easy and see. I mean, I would literally be driving to my internship. This was at Tampa General Hospital, a big trauma one, and I would hear an accident on the highway, and I would get there, and I literally would be going to see that patient in the burn unit.
Wow.
So, I mean, that's not where I ended up, and I didn't want to do intensive care or really acute care therapy, but it just opens your eyes to where it all starts, and coming from where the injury starts all the way through. And so that was the route I went. And then for my second internship, I did pediatrics. Now, it wasn't in a hospital setting, it was in a versatile clinic, but so we saw, it wasn't as specific as some clinics can be, and we went out to schools, we did private setting, we did home settings. So again, it was pediatrics, but you literally saw it all. So that really helped me to open my eyes to not just narrow in on geriatrics or pediatrics like a lot of my colleagues did, because they knew they wanted to do a specific field. And also, you're going to be tested on all of it, in the boards, and it really helps. And I tell my kids this today, getting that hands-on physical experience is going to help you when testing. So you can read all you want, but getting in there and really seeing how it works is so important. So if that answers your question, I would definitely explore both areas. And we've talked about this a little bit too, Monica. Geriatrics and pediatrics cross over so much. So you can apply your skills. I came from the hospital setting, the geriatrics to pediatrics, and I'm like, wow, sensory integration can go into geriatrics as well, or desensitizing, or, there's so many different things that go on, and it can be from the pediatric level and then to the geriatric level, especially when you're reaching people in the dementia units. Mm-hmm. So the cognitive therapy. So I guess my biggest piece of advice is don't narrow in on one setting, be open-minded, and try and get the internships that allow you to explore so many different areas within that setting.
Right, that's good advice. So also kind of like speaking to your experience in the hospital setting, how do you, and I know not everything will be a hospital setting, but how do you see the role of OTs kind of working collaboratively within healthcare with different professionals within healthcare?
Speaking of the hospital setting?
Not specific to the hospital setting, but just in general in health.
Yeah.
I know it depends kind of on the setting you're working in, how much access maybe you get to doctor's notes or nursing.
Yeah. And I'm telling you, the education to these other health professionals is still needed, because you'll get a patient, for instance, even when I was working in skilled nursing, and the patient had a hip replacement, and we know the functional level that person is at, and we also know the precautions that they have to follow. Well, they'll go they'll go to their, 1 week follow-up and the doctor signs off, oh, you're ready to go. Like, you look great. X-rays look great. In no way did he check her function, look at our notes, even if we've sent them. Is she following her precaution? Is she at a huge risk of dislocation? Where is she going home to? Is she going home with anybody? And that has been a big change that we've had to really advocate for. And our lobbyists, I believe, are working very hard on this because of all the recent insurance and Medicare cuts and pushing these patients back into the home setting maybe too soon and not really individualize their care. So care is becoming more based on a diagnosis or, an injury rather than what therapeutically is safe and appropriate. So as OTs, we really have to get out there and advocate and educate and our purpose. And, with the PTs, they'll get them walking and, but I always tell people the difference between PTs is the PTs are going to get you where you need to be, but the OTs are going to help you to do what you need to do once you get there. So safely. So I try to stress that to nursing.
That you say that because I know a physical therapist, and that was exactly what he said. He said the PTs are going to be able to get you there, and the OTs are people to help you facilitate being able to do what you need to do once you get there.
Correct. Yeah. So, just working, and it is a team approach, and every professional is important. And it's just a matter of fighting modern medicine. And, the doctors are overworked and they're trying, we're hitting into the baby boomer generation, especially down here in Naples, Florida. The flood of people that are coming in and, the doctors are taking on more than probably what they can handle. So we really have to stay on top of, what is best for our patient. And, I've never had a problem where the doctor's like, oh, no, they need to go home. I mean, maybe once or twice, but they'll really listen if you get in there and tell them, look, this is what's going on. We really think we need another week of therapy. Please, sign off, and they'll do it. They're just in a different world. So they're not trying to be malicious about it. They're just trying to get their job done, and they're under pressure. You'll get into these settings, and I don't know if anybody's observing in a skilled nursing right now, but the payment system has changed over the past couple of years. And the length of stay has shortened. A lot of people are missing out on the skilled rehab and going right home. So we'll see what the trend is the next couple of years, and it is ever changing. But again, just knowing your profession and the importance and your patient and just educating.
Sure. Okay, so I feel like I always like to ask people the two-sided question. What advice would you give to your past self, maybe although I know you had a little bit of a different trend, but in the application stage in terms of applying to grad schools, and then maybe as a new grad, just, ready to go, and what you wish you had known that would have been helpful to you?
Yeah, definitely. My application stage, I guess, from talking with you, Monica, wasn't as complicated because we kind of were led right into that easy access. So, but with that said, I did have to make the decision. There is another school here in Florida that is very well known for their clinical skills and their manual therapy and coming out as a very strong clinician. So I knew if I was going to go that quick, short route, I really had to hone in on my clinical skills and my internships. And once I got out, so, it did, I guess I would say money was a big factor in choosing my short route. And I was also getting married. So that's what propelled me to do that quick 5-year plan. But I definitely think I would have come out a stronger clinician if I went to that other school where it was more clinically focused. One thing I did want to touch base on as a new grad, that I wish I would have been told to look out for, because you will be thrown to the wolves and there's a high need for us. And when you get in there and these therapists are just running like crazy, a lot of them have been there. A lot of them don't have time to sit down and train you. But make it a point when you are looking, ask if there is a mentorship program. I really missed out on that. I got into a setting, the skilled nursing setting, and I was the only OT in this setting. So, and we had a director hopping from different facilities. So I really was, I had to fake it till I made it, basically. But, you just have to hold your head up and do what you have to do. But if you can, really look for those places where you're going to have a strong mentor, experienced therapists, and maybe on your interviews talk with the other therapists if you can, and get a good feel of the environment, because there are environments out there that are very corporate oriented, and you're going to see the constant turnover of therapists, and as a new grad that might not be the best place to jump right into.
Sure. What do you think makes you competitive kind of as a new grad seeking a job?
Say that again, Monica.
What do you think makes you competitive as an applicant for a job when you are a new grad?
Okay, so personality does play a big part, and I have taken on students in the past, like I said, when I was getting into teaching, and you have, even if you're not on your best game or didn't have the best night, think about this setting you're going into. These people aren't feeling well. They've just had a life-changing event. You really have to go in with energy and a positive attitude. And I see it a lot. I see therapists out there that just are ho-hum, and nobody's getting anything out of the treatment session. And, we're paying for this. So really up your game with your personality, be a go-getter, be exciting, and, show that you want to be there and you're really excited to get involved with their team and be a team player, and just you want to be there and you want to learn. So yeah, I would say personality and energy is huge.
Awesome.
So with that being said, like when you're getting your fieldwork 1 and 2 students, what are you expecting from them? Like, what? And I guess a follow-up question to that would be like, what are you expecting in fieldwork 1 versus fieldwork 2?
Right. Okay. So yeah. So fieldwork 1, you're going to be just, you haven't had much experience. This, I believe, is in your first year of the program. Is that correct? I can't remember.
I think so.
The fieldwork 1.
So there's a good amount of time in between.
Yeah. So, and that's another good point. And I hope the colleges are really choosing therapists that are appropriate to facilitate teaching, because it is very scary going into these settings. And one of my fieldwork 1 was in that hospital setting, in the trauma unit, and I had no idea she was asking me, what was the term? HTN. What does HTN stand for? She was throwing medical terminology at me, and your brain is just spinning, and you're like, you know this, but you can't spout it out. So, I guess I would say, just for the level 1, I always try to be that teacher that initially made those people feel comfortable. It was all about building a rapport. The skills are going to come. You're just coming out of school. Let's get the personality there. Let's see some excitement, eagerness to learn, asking a lot of questions. I really liked that with my students, and engaging with the patient in conversation. Level ones, I think I was letting my level ones transfer patients at the end with me standing right there, but I believe it's more, if I can remember, observation type setting. And I believe ours was only a week long in 2 different settings. I'm not sure if that's how it is still. So then you, okay. And it might vary, and state to state is also different as well of what the requirements are. So level 2 though, you got to be ready to go. This is it. This is a lot of times these places are looking for therapists. So it's almost like you're interviewing for 3 months. This is a real job. You're there full-time working hours. And, that first week is your, get your feet wet, your observation. But after that, you are developing treatment plans, you're starting evaluations, writing goals. So by level 2, definitely be prepared to be way more hands-on. And a lot of my patients by halfway had a full caseload and were carrying it out independently.
Wow, that's amazing. Okay. So I was under the impression that the school did pick it, but earlier I got confused. Do you like put in a bid for like what type of field work you would like to do, or how does that work?
Yeah, well, and every school is probably different, but we had to rate our top 3, I believe, for each one, 1, 2, 3. And it is tough, and that's schools are, we have to be better as therapists too, because schools are really needing us as therapists to be those educators. And, there's not a lot of us out there. So, and it can be very challenging for schools to find people to take on students, because it does take a lot of time. I would stay after hours. I would get there early, especially those first initial weeks. So for my particular school, we rated our preference, and also we were also allowed to seek out. Some people went overseas. Some people had specific states they wanted to go to. So if your school does not have a relationship with a specific healthcare facility, you can always be an advocate and try to promote that relationship, I would say. So if you can, I was limited and I had to stay in Florida, but if you can, I'd say go for it. Go travel. A lot of them will provide housing. It's the one time you can really go and do that, except if you get out and start as a traveling therapist or do that as part of your career, which is a really cool route to take as well.
I know, Sam, just from kind of going to the informational sessions, I think Rush also has you rank kind of your preferences. And I know there were a couple that I went to that pediatrics is always at least one of the settings that they mandatory. I don't know how prevalent that is in general, but that was.
I think PEDS was one of our mandatory as well. I think the problem ran into the limitation of sites. So I think some people got out of that didn't want to go into PEDS. So, but like I said, you're going to be tested on it, and this is your one chance to explore those areas. So I think it's great that the colleges push the diversity of the clinical settings, because that's who we are, and we have to be diverse as therapists.
Yeah, for sure.
So you talk about.
Go ahead.
Sorry, you talk about like
Does anybody else have another question? So
oh yeah.
That's okay.
Um, well, until someone does, I was gonna ask you talk about the like getting a diverse experience within your field work, but is there any like experiences that you thought were like monumental or that you wish you had before you had stepped out into the field?
Well, Monica's a perfect example. Like it's super cool to see somebody like that out there being a caregiver, because you're literally living and breathing it daily. And I tell her this in my recommendations. I can tell you all these things and recommend in the perfect world, but I know you're living it daily, and it's not perfect every day, and the routine isn't the same every day. And my husband always told me this is a good example or analogy. He's a builder, but he started out as a carpenter, and while he was in college, before he was in college, he was going out into the field and learning the different trades within that environment. And you know what? So many of his subcontractors respect him for that, because he really knows. He didn't just go to school to be a builder and learn how to build things from the computer up. He literally knows how to go out there and hands-on do it, and hammer a nail and plumb a pipe, whatever the case may be. So getting out there and being a caregiver from our setting, or just even working in a hospital and admissions and seeing all the diagnoses that come in, and or working as a receptionist at a healthcare clinic. I actually, through college, I worked as not an assistant, just as like an aide. And it gave me a lot of experience to see what everybody was doing in all different settings, because I wasn't just specifically with therapy. So it gives you a greater appreciation. So if you can, I would definitely be out there, even if it was finding a little part-time job, a couple hours here and there, to get involved in a setting and just to gain the knowledge, because there's so much to learn.
Awesome, thanks.
Yeah.
I have a question. So what type of clinical examinations do you typically do?
Like what am I seeing and where I'm practicing right now?
Yeah, like what would a example be of some maybe like clinical type of work that
Okay.
you've been doing?
Yeah, so just right now I'm in an outpatient clinic. It's called the Center for Healthy Living, and like I said, Naples is inundated with orthopedics. So my typical patients right now are just your general shoulder pain or a total shoulder replacement, arthritis. I'm doing some hand therapy. But prior to that, I was in skilled nursing for 13 years, and I saw it all. Parkinson's, stroke, orthopedics again. We even saw alcohol abuse and effects, and falls, and cognitive injuries. So like I said, I've mainly been on the route of geriatrics, so I'm seeing more of those type of diagnoses, but I'm trying to think of some more specific. But I will say, everybody is so different, no matter what the diagnosis is. And that's the cool thing about it, is no one hip replacement is alike, because think about it, we're OTs and we're preparing this person to become independent again, and everybody's life setting is different, and how they go about life, and do they have stairs, do they have somebody at home, do they have somebody to help with meals, what's their bathroom setting like. So you can be in these skilled nursings and get these specific diagnoses, but our job as therapists is to hopefully train these people. I would literally mock up a bathroom setting, depending on this person's home they were going into. So you really have to customize the treatment accordingly to each patient you get. I don't know if that answers your question a lot, but you know, I guess my experience is mainly orthopedics, a lot of Parkinson's, strokes, pain. I did want to say outpatient is definitely not a setting to go into post-grad. Definitely get your experience out in acute care or a skilled nursing rehab, because you will get patients in outpatient, and it's a very generalized diagnosis. So you really have to be up on your assessment skills to know and to pretty much diagnose where this pain is coming from. And then you have to treat accordingly, or going down the cognitive route. And Monica and I have been brainstorming together with Mary. You know, every day is a little bit different, and she's in between stages. And then we have the family dynamics involved. So really just customizing it to the patient and having that knowledge of what setting you're in. Also, I did want to say, if you are interested in the geriatric type setting, I definitely would do a year in acute care coming out. I really highly encourage that, because you, like I said, you're going to see so much of them coming out of surgery, and the orthopedics are going to be in there, or the doctors are going to hear it specifically from them. Whereas once they're out of the hospital, you're not seeing those doctors one-on-one or those other specialists. So getting in there and getting that medical terminology right at the nitty-gritty is so important, and then branching out from there.
I have a question. What are you kind of most inspired by and excited about within OT currently, and then for the future? And then also, aside from documentation, what is the most frustrating aspect to you?
Yes. So, yeah, I guess my excitement with OT still hones in on the opportunity and the growth. And, you know, research is important, and all the new modalities and interventions and approaches that are coming out. And we are constantly, as a therapist, you have to have, I think it's 30, I just did this, I think it's 32 credits every 3 years, or in Florida, we have to have 26 continuing education credits every 2 years. And I love it. I love going back to school, and I love hearing from these people that are giving these scenarios, and you're a treating therapist and you're like, oh, I can relate. Oh, I can go back tomorrow and I can try this technique on them and it might work. And you know, one thing I really did like about the skilled rehab setting was the fact that a lot of my patients were with me for a week to 3 weeks to sometimes longer. CVAs were there for sometimes 3 months. You really built a relationship, and you really got to see results. And results are so encouraging to me. I'm the type of person where I love to go mow the grass because I see the instant gratification. I want to see the results. Whereas in peds, you're going to take a lot of times you get in there, it's a little, you know, the goals are set for a year period sometimes. So you're not going to see, it's easy to see those therapists kind of get into a routine of just working on one specific skill for months and months and months. So one thing I really like seeing as a therapist is results and progress. And I'm going to push and I'm going to try anything I can to get this person to be independent and live a quality life, because that's important to me. I know what it's like to, you know, break a bone or have an injury, and how much it affects somebody's lifestyle and the mental health of it also. And I think that's a big area as therapists that we need to continue our education on, is being able to read these people and making sure they're mentally well, because that's going to be how they're going to heal best. As far as the documentation goes, You know, it's worse in some settings than others. And it is a very tough thing as a new grad to come out into the world and be able to do. So just like I said, when you are in the settings and you can do a chart review, if you are working in that environment, always do it. Read, read, read. I can't stress that enough. Understand and Google. I mean, we have Google at the touch of a button now. What does this mean? And, you know, really read into what is going on with this patient, and it'll start to flow. And like I said, you'll get your cheat sheets, and if you have that mentor, they're going to guide you. And everything is, I believe, electronic now. So they do have, like specifically our program, we do have goals that are built in that you can choose and customize. So that helps too as a new grad, and establishing your evaluations and interventions. So you know, whereas when I started, it was all paper pencil. I had to come up with everything out of my brain, and as a new grad, that can be hard. So I think you guys do have the advantage of coming out into the technological world of healthcare. You're going to have those terms and phrases that you can really build off of and really customize it to the patient.
I wanted to ask, what kind of surprised you most, like just when you were in school and in your grad program versus when you got out? What did you find kind of the most different or surprising, you know, that you just hadn't anticipated?
One thing that we never really honed in on at school was the business side of things. And that's a huge component of the medical world. It's almost becoming a business model, unfortunately, these days. And, you know, I went from a new grad to coming out into the world of therapy, where we could provide an hour and a half of OT if we felt like they needed it that day, especially if it was a CVA. Whereas now, they're allotted so many minutes. You may only get 30 minutes one day. You may be lucky if you get 45, and you only have a week to get this done. So the pressure is really on. And that was one thing that I guess it would be good to, as a student during your internship, is to really, and you'll see it because you'll hear the therapist vocalize about it, because it is very frustrating as a therapist when you know that this person needs more, and you have to get real creative in how to provide those interventions in a short period of time, or use other areas where you can, you know, utilize the family members. The education is huge. But yeah, the business side of things is becoming a tough cookie to swallow. And that is really why I left skilled nursing. I loved it. I loved being with those patients for weeks and seeing them walk out of there and be home independently and stay home without falling. And you know, now it's becoming a different world where they're getting kicked out in a week and they're home and they're not ready, and you're seeing the fall rates go up. And as a therapist, you kind of feel deflated. So you know, when I got back into outpatient therapy, I just felt like I could gain a little bit more control, because I do have the control of the length of time that I'm with this patient, as long as it's functionally necessary. So, you know, you always have to keep that in the back of your mind. But as OTs, we're very creative, and you have to get creative back to documentation. That is very important. You always have to be showing progress, and what are you doing and why are you doing it, and is it specific towards your goals? So you'll learn all that. But the one thing that you might not learn in the school setting is the business approach to a lot of these medical practices these days.
Right. Yeah, that's ever evolving for sure.
Yes.
My brother as a pediatrician, and it's just a very different world. He regularly talks about it's shifting.
Yep.
Just kind of crazy.
It's tough. Yeah. And I don't think it's going to get better anytime soon. So you just have to really advocate and be creative.
Outside of kind of the continuing education and maybe people you currently work with, how do you sort of go about professional growth in terms of like just connecting with other OTs, just to like discuss things and remain open to other ideas? And are there different meetings and maybe associations that you're part of, or how does that work for you?
Yeah, so there is the FOTA, Florida Association.
Oh,
yeah,
yeah.
so
I thought I was very original.
When you said that, I was like, oh, where are we speaking to the Florida OT Association? Anyways, but yeah, so you do have those associations, and it is a tight knit group. Also, my college, I mean, they stay in touch with us constantly. Like I think I told you about a class they were offering. A lot of them offer free classes, which is so cool to grad students for continuing education. But also just, stay in touch with your classmates, see what they're seeing, get their advice, be open-minded to other ways is a big thing with me. Sometimes I'll get stuck in a rut with a patient and you just don't know what to do next, and don't be afraid to branch out and ask even another OT you're working with. Know which way is better, and everybody is different and every patient is different. So one approach that a therapist might be doing may be better for your patient, and your approach you're doing with your patient might be better for their patient. So work as a team, and just be open-minded to other approaches, and continue your education. It's so important because there's so much to learn.
Yeah. What are you kind of most excited about in terms of the future of OT? I know I had seen, I don't know if it was a sonogram. I don't know if a sonogram is only for pregnancy. You know what I'm talking about, in your room. I was like, oh, what is that? Like, I'm so surprised. I'm really like intrigued that you're using that. And what do you use it for? And I would have
the ultrasound.
Ultrasound.
Okay.
Not the sonogram.
Like, I don't know if there was a sonogram in my room.
Yeah,
the ultrasound.
Interesting. Yeah. So kind of that technology is very intriguing to me. What are you most excited about, kind of just like looking forward into the future of OT and the scope of your practice, or maybe also just general practice of OT?
Yeah. Well, and speaking of modalities, that is ever changing as well. And I believe you probably saw the ultrasound machine, but it also had a low light laser therapy device attached to it as well. And that's like the newest type of therapeutic modality intervention that the therapists are seeing great effects on that. And you can read up a little bit more on that. I'm still not even completely knowledgeable on it. But it's called low light laser therapy, and it's becoming the newest and greatest, especially for orthopedic and pains and tissue healing. I am a believer in modalities, using them the right way. And I don't think we weren't trained in modalities coming out of school, so I had to seek out additional education. A lot of OT programs don't train their therapists. PTs, I believe, come out trained, but that could be changing. I'm not sure. But yeah, utilizing all those approaches and, the newest ways of technology. I think the technology in our practices is huge. I know you hear me using a metronome with Mary a lot. And that is a great program. And unfortunately, a lot of these programs can be expensive, and we don't have interactive metronome where I'm at, but that is
interactive. I saw the site once.
Okay.
You looked it up, but So what is, I guess, the full scope, or, you know, a very like brief
The
version of
goal of,
the program versus, I know I have the app for her on
right.
already, or sometimes when we're doing a different activity.
Mm-hmm.
I've done it because I know, you know, you obviously have promoted it. I don't like 100% have an understanding, especially about the full program.
Yeah, and that is actually, interactive metronome is something I was certified in on one of my level 2 rotations, which was so cool, because I did all the steps, and then once I graduated, I think I could take the test and become certified. So I came out with that, and it was in my pediatric rotation. And speaking of, crossing over, I branched it right over into my geriatric population, and the research is huge with this program, specifically because we are honing in to the brain. It all has to do with the brain. Everything starts from the brain. So getting the timing and rhythm of the brain working in a coordinated fashion is going to only help your movement. It's going to be easier to move, more fluid, and it's going to, specifically for geriatrics, we're targeting balance, for instance, and walking, and their gait pattern. And but I've told you to play it during. While she's getting ready, get that brain moving in a constant rhythm. Now, the problem is, for our circumstance, we didn't have the biofeedback that the program would give her if she went through the whole program. And you can seek out, say you have a patient and you really think they would benefit from these programs, you can seek out, like you were to look up my name on Interactive Metronome, I would be listed.
That's how I found the website.
Did you? I would be listed as a provider. Unfortunately, the setting I'm at now, I don't have the equipment, but the equipment is where you're going to really see the effects. And then from there, I'll tell my patients to just use the app, because there are home programs, but you want it to make it compatible and the compliance there. So you just tell them, okay, I want you to play this metronome 54 beats per minute while you're getting ready in the morning, or if you're walking on the beach, 75 beats per minute. And after they've been through the program that provides those specific exercises and activities and the biofeedback, the brain is going to react a little bit better. But, in general, just using a metronome, think about the piano players, that helps them keep their timing and rhythm. So it doesn't hurt. It's just a matter of if your setting is going to have those types of programs. But there's lots of those types of programs now. And another thing I was going to mention too is, seek out, we're right next door to the personal trainers that are in the wellness area, and they have some great innovative techniques they're using. They brought over this ball, and it's just a vibrating ball, and you can literally put it on your back and help those muscles relax, and you see the effects instantly. So we use electrical stimulation a lot, but this is just a really good technique that you can get those instant relaxation results. So everybody has their new ways, and there's so much coming out. You just have to stay up on what is going to be in your clinic and who you're going to be treating, and keep up with the times, because it's ever changing.
Yeah, for sure.
Hey, I just want to say something, Monica and everybody else, and we can very soon it will be an hour since we are talking, and we can go beyond that. No problem. I would enjoy it too. But maybe one or more of those who are attending today need to go to class. Some of them take a class on the next hour, beginning at what would be here here in the Chicago area, 1 p.m. So I just want to acknowledge and say thank you for coming to Katrina, Miko, Lauren, Taylor. I think Taylor is I believe is in one of my courses online, and I'm very excited you are here, Taylor. Thank you for being here. But we can continue again a little bit beyond noon. Thank you, Katrina. That's it, Monica. Maybe you want to tell them if they want more information about the club, information about how to contact you. Maybe you want to remind them, Monica, about that.
Sure. Yeah, I think we're probably going to have some presentation and for the remainder of the semester every week, which is pretty short-lived. I believe we end mid to late May. So there aren't so many left, but I do want to get just different information out there that might be helpful. And you can email me at whitem168@dupage.edu. I'll type it in the chat just so everyone has it if there's any interest. And I'm really excited because this is kind of just the beginning, and there are different areas that OT works with. That is what makes, I think, OT so incredible. And just, it's an across the board thing, but it's not so general that there aren't different avenues to pursue it. I just think it's full of opportunities and really enhances everybody's lives. It's kind of almost like, although, insurance won't necessarily cover it, I feel like it's almost like therapy, like regular therapy, like anybody can benefit. That's sort of what's so great about it. You might have to have a documented need for it, which is a little bit different, but yeah, it just really enhances everybody's lives. And there are so many little things that I know I picked up on and learned through just my observation hours in general, and just in conversations with different therapists that are, the thing I think about OT is sort of like, in a way it's so simple, but it's like a lot of the things that people don't necessarily just zone in on, that like a lot of people kind of like look past, but it's like everything really sometimes is in the details, and those are the important things that we can overlook. But when you're more specific and intentional about your focus on them, it really can amplify the quality of life. And I think that's just, for me, like just what draws me to it, and why I'm so passionate about it, and why I think it's so valuable. I'm gonna write my email address in here, and then I know we are pretty much out of time. If anybody else has an additional question, please feel free to ask. And thank you in advance, Kelly, for your time.
Yeah, and you guys feel free, you're welcome. Feel free to email me too if you have any questions regarding what I said or anything specific in what I didn't say. And I'm pretty good with email, so I'll get back to you.
Which email? I'm going to write, or you can write in the chat, whatever your preferred email is.
Oh, sure. Yeah.